Hey guys, so today we're gonna be working on my beautiful client. So today she came in concerned about her acne. So she has a little bit of inflammatory acne going on. So with acne, I 99.9% of the time recommend getting chemical peels to help treat it, and that's for your in-office treatment. So we want to make sure that we kind of clear out all the congestion that's going on underneath, inside the pores, and bring it to the surface so that way we can clear everything. So I'm going to be doing the PCA Sensi peel on her today. That one's a TCA peel. So basically what that means is it's good for any Fitzpatrick, so any skin color, skin type can kind of get this treatment. It's great for sensitive clients, so pretty much anybody can get this peel. It's all around like safe peel for anybody, and it's great for acne. It has azelaic acid, which is great for acne. It has kojic acid, which is great for brightening. It has the TCA, and then it also has lactic acid, which is a hydrating exfoliant that derives from like milk. So that's gonna be really good to help clear the acne and exfoliate everything, which is what we want before we start getting into like micro needling for deeper kind of scarring and stuff like that. So we're gonna start off with a cleanse. We just want to make sure we get all the dirt and debris off, so that way you're not letting anything kind of come into that compromised skin that's going to come after the chemical peel. We want to make sure that she's all nice and clean. So then we're gonna go in with the smoothing toner from PCA, and we're gonna use this to degrease the skin. Some clients might feel a little bit of tingling or itchiness with this, but that's totally normal. You just don't ever want anything to burn. Okay, so this is our guy. So PCA Sensi peel. We can do up to 4 layers on this peel, and we gauge it by the client's sensitivity. So after each peel, we're gonna go ahead and ask the client on a scale of 1 to 10 how their skin is reacting to it. Because like I said, we don't want anything to burn. Tingling is okay, burning is not, ever. So with chemical peels, you want to make sure that you're using a good amount of pressure, because that's what's going to help the peel kind of enter the skin and kind of get a little bit more benefits, is when you're applying more firm pressure. Just be careful around more painful, inflamed acne, because you don't want to hurt your client. Alright, so now after we've applied the first layer, we want to let it sit for about a minute or two. We're going to ask our client how she's feeling. So, Angel, on a scale of 1 to 10, 10 being absolutely horrible, take it off, what number would you say your skin feels?
Like 2.
2? Okay, so good to go. She can get another layer, so we're going to wait a little bit and go ahead and apply the other layer. So I'll be right back with that other layer. So I love PCA chemical peels because they're more progressive rather than aggressive. So a lot of clients don't really want to peel that much. And the way that these work is they work more intercellular. So they're gonna work from inside the skin to help clear out what's going on without the need to peel so much. So typically that's what a lot of my clients prefer, because having downtime, like shedding like a snake, is kind of a lot for some clients. So this is a more, I guess, like sought after way, so that they don't have so much downtime if they have things going on and stuff like that. But with chemical peels, you want to make sure that you're going to be staying outside of the sun for about like 3 days to a week, because you could risk the chance of hyperpigmentating your skin. You don't want that. So you can cause more damage than good if you like go in the sun, don't apply your sunscreen. So make sure that you're applying your sunscreen every single day, every 2 hours, even if you're at home, because you have windows and those UV rays come in through your windows. Little fact for you, you didn't know that. Okay, Angel, how are you feeling after that second layer?
Still like a 2.
A 2?
Yeah.
Okay.
Is that fine?
Yeah. So we're going in with our third layer now. Still using firm pressure. Okay, so we've just applied our third layer. So depending on how she feels, we can then go in with the fourth.
That was like a 4.
You feel it at 4 now?
Yeah.
And that's fine. So what we're looking for when we're doing a TCA peel as well is we're looking for erythema, frosting, and the client sensitivity. So frosting typically kind of looks to me like somebody smeared cigarette ash on your skin, like white cigarette ash. She doesn't have any of that, so we can proceed. If she did have some, we would just avoid those areas and do the other areas. Same with any erythema, which is redness. We would avoid that area, do the other areas so that she gets a really good treatment. This is our fourth and last layer. She is tolerating it really well. Her skin's very resilient, so she's doing well. She's able to go up to the fourth layer, but don't be discouraged if you're not able to go up to all the layers. You're still getting some really good benefits, and we will work your way up to there, but it's better to stay in the safe zone than possibly create some damage within your skin. So it's always important to let your esthetician know if you feel any intense heat. So avoid working out, sweating, anything that kind of heats up your body for about 48 to 72 hours, because since they work off heat, you don't want to reactivate it because you could get a heat rash. Okay, so after we've applied the fourth layer on, we're gonna go ahead and stop with the layers. If the client wants, we can add some more exfoliation to the skin. So what we offer here would be the PCA Skin Advanced Treatment Booster, and this is an additional add-on, but this is gonna help the exfoliation process and give you more benefits because it is in the retinoid family, so it'll help with that cell turnover and get better results. So we're gonna go ahead and add this on her, and especially since her skin is doing pretty good, I feel confident that she'll do well with it. So we're gonna go ahead and apply about a pump or 2 of this onto her skin. So after we do that, we're gonna go ahead and apply moisturizer, corrective serums onto her skin, and SPF. You wanna make sure that you always put SPF on your client because they're gonna be going out in the sun. You wanna make sure that they're protected and everything like that. So again, you don't wanna heat your body up or sweat for about 48 to 72 hours. Make sure that you wear your sunscreen every single day, every 2 hours, to protect the skin that we are trying to correct, because it's easier to save money on preventing pigmentation than correcting it. So you guys have to make sure that you're wearing SPF. So pretty easy, pretty fast treatment. My favorite moisturizer, this is the PCA Skin Rebalance Moisturizer. It gives you a nice glow to the skin, super moisturizing.
I guess I do have a question. So when it starts pilling, do I help it pill or just let it do it by itself?
So that's a good question. You won't really peel with this. You might get some flaking, but in the event that you do peel, you don't want to peel it off with your fingers. You can cut off excess skin with scissors, clean, sterile skin scissors, and you can just kind of slice it off, but don't peel it off. And then you don't want to wash your face tonight. Just leave it. You want to leave so we don't take this off. It's self-neutralizing. So this peel works over time. So we're gonna leave it on the skin to help get those benefits throughout the day. And then tomorrow morning you could wash your face. So now we're going in with our weightless SPF 45. Anything above SPF 30 is what I recommend. And SPFs with zinc oxide and titanium dioxide, which are physical sunscreens. Those help in blocking the UV rays from even entering the body, so it's kind of like a shield. So that's why I love those. And just like that, she's all done, nice and glowy. She's gonna get that acne taken care of, and she's gonna be looking fabulous. So you can get a chemical peel about every 3 to 4 weeks. and they work best as series. So you want to make sure that you're being consistent and coming in every so often for your appointments to make sure that we go ahead and knock that acne out, because everything is consistency based. You have to be consistent with your skincare and so you're able to see the best results. So yeah, so she's all done.
Thank you.
Of course.